So I'm starting the session now and waiting for your questions. Please raise your hands. Again, repeating, the digital hand, which is in the more option, you have to raise the hand and you have to pose the question. I will not only take the question and give the reply, but I will discuss that question with that candidate so that the answer will be that candidate will understand the answer in a better way. So first candidate, so again repeating, if you are having any background noise, please don't raise your hand because your background noise will disturb whole of the class. So I got one hands on from Dr. Rajesh. Dr. Rajesh, we are sending you unmute invitation, and on accepting you have to say hello so that we will check that your voice is properly coming to us. Say hello. We have sent you the unmute invitation. Please accept that unmute invitation, and on accepting say hello. Don't unnecessarily raise your hands. If you are having any question, then only please raise your hands. Yes, Dr. Rajesh.
Sir, there is a little difficulty for me in while doing transvaginal. I'm able to see only one side of the ovary. The other side is not visible by all sorts of movements.
Please elaborate your question so that I can give you a detailed answer.
Sir, first I insert the probe with that marker towards the ceiling, and then I give horizontal movement, and then I rotate it 90 degree, and then I give this vertical movements. But still I am able to see only one side of the ovary. I'm able to see uterus properly, everything properly, but for ovary,
I got your question. Now see, imagine that this is a TVS probe. Okay, can you see this?
Yes, sir.
Click over here. Okay.
Yes, sir.
Now, when you are inserting it, now see to the monitor also. When you are inserting it,
yes, sir.
If you will insert it straight,
okay,
what you will hit first? Uterus, rectum, right ovary, left ovary, or bladder? What you will hit first?
Uterus.
Before uterus, what you will hit?
Bladder.
Very good. Now keep the anatomy in your mind. Whenever you are doing any ultrasound, I call it Sonu anatomy. So keep your anatomy in your mind whenever you are doing any type of ultrasound. Now, coming back to the question, when you are inserting the probe, you are hitting the bladder. If the bladder is full, the uterus will be pushed away and you will not be able to see the uterus. That is why we are taking these transvaginal ultrasounds on empty bladder. That is point number 1. Now, when you are inserting the probe, now you will not see much of the bladder because there is no urine in it. It is not distended. Now you will hit the uterus. Am I right or wrong? Dr. Rajesh.
Yes, sir.
Please be interactive. Now.
Yes, sir.
Now you want to see the ovary. Now you have to think. Then you have to do ultrasound. You have to think 99 times, and on the 100th somewhere you have to do it. That is ultrasound. Now, if I have inserted it straight, to see the right ovary, what I have to do? I have to slide or fan towards the right side. Am I right or wrong, Dr. Rajesh?
Yes, sir.
Where my hand will go, towards the right or towards the left side of the patient?
Right side of the patient.
No. That is what I am saying you. You have to think 99 times before attempting any ultrasound. Now see, the probe is inside. I cannot see to this piezoelectric crystal. Now see over here. I can see only the handle. This is the handle. If I will take this towards the left side, where the piezoelectric crystal is going, onto the opposite side, yes or no?
Yes, sir.
Now it means that to see the right ovary, I have to take my hand towards the left side. Yes or no?
Yes, sir.
Yes. Now, where is right ovary? Is right ovary completely towards the right side of the uterus? Yes or no?
Yes, sir.
No. I told you, you have to think 99 times. Is right ovary absolutely on the right side of the uterus? I'm using word absolutely in all times. Is it all times onto the right side? No. The ovarian position vary from patient to patient. It will not be completely, I am using word completely onto the right side. That is why when you are taking it, the piezoelectric crystal, toward the right side, and if the ovary is not in front of your piezoelectric crystal, you will not see to the ovary. Now,
yes,
you have to search for the ovary. To search for the ovary, you have to search by your transducer onto the right side.
Okay.
This is a question and answer session.
Yes, sir.
I will not take whole of the class over here because
yes,
these things are already taken when we are taking the gynecological ultrasound. The
yes,
ovarian sir. Location, is it fixed? No. You have to search for the ovary. Even the ovary can be at the level of the pouch of Douglas. Now, if you will take your probe towards the right side, and you will not fan, you will not search for the ovary, you will not get the ovary. So you have to search for the ovary.
Okay, sir.
Okay.
Okay, sir.
Now, why the ovary? Now, question. You have posed me a question. I gave you a detailed answer. Now I will counter question you. Why the ovary is not having a fixed location? Why, Dr. Rajesh? Why?
Because of different anatomical situation for different persons.
Very good. Now it depends on the broad ligament.
Yes,
Broad
sir.
ligament will define the ovarian location. If broad ligament is this much, the ovary will be here. If broad ligament is a little more, this will descend down. And if there is any adhesion in the pelvis, that will pull the ovary. So that is what you have to see. You have to see for the ovary. You have to search for the ovary. You don't have to be 90 degree towards the right and 90 degree towards the left to get the ovary. You will never get this way all
yes,
ovaries.
Sir.
Maybe
Got
that
the
you will
point.
get sometimes, but not always. And now there's a landmark. That is the internal iliac vessel. Now, if you are facing any difficulty, you can trace along the iliac vessel. And mostly, not always, mostly you will see that ovary is looking like it is sitting on the vessel. So trace from the vessel also. Okay.
Okay, sir.
Anything else?
Thank you, sir.
Yeah. Please mute your microphone so that I can take the next candidate.
Okay, sir.
Okay. Please mute it. Mute. So next candidate, please raise your hand if you have any question. But if you have a background noise, please don't raise your hand because your background noise will disturb whole of the class. So I'm waiting for the hands-ons. So please raise your hands. Take him. What is his name? Dr. Simbli and Dr. Padma. We are sending you unmute invitations. Please accept the unmute invitation. And upon accepting, you have to say hello. Dr. Padma,
Hello.
say hello. Dr. Simbli. I'm very sorry if I am pronouncing it wrongly. So say hello.
Hello, sir.
Yes, what is your name?
I am Dr. Mohammed Simbli.
Yes, Dr. Mohammed Simbli. You are from which state?
I am from Srinagar, J&K.
Yeah, tell me your question.
Thank you so much, sir. My question is, which is the best position to get the ovary, like trans-abdominal or it is endovaginal?
Okay. So the question, I'm Dr. Simli, I am repeating your question. The question from you is that should I go for should I go for a transvaginal ultrasound if what is going in your mind? I am trying to smell your mind. If I am not getting an ovary on transabdominal probe, should I switch to the transvaginal probe? Is this thing going in your mind?
My question is, when I am doing a trans-abdominal ultrasound to look for the ovary, should I use the transverse view or longitudinal view? Which is the best position?
Your question. Now, please elaborate your question. I have got your question, but I want everybody to understand the question first. Please elaborate your question.
I am doing a trans-abdominal ultrasound. Curvilinear probe, sir. Now I want to look for the ovary. Is the transverse view better or longitudinal view better? Because usually find difficulty with the
got it. Now, one point which you have to be very clear. Now the question posed by Dr. Sibley is that should I put it, I mean the transducer, 90 degree this way or longitudinally? Now, before answering this question, please be clear of something which we are discussing right now. Now, Dr. Sibley, how many years of experience you are having in ultrasound?
Sir, I don't do gynae ultrasounds because I.
How many years of experience you are having?
1 year, sir. 1 year.
1 year. Now, tell me one thing. When you are putting probe on a pancreas, let me take a pancreas, because this way you will understand better. Where is the pancreas? Yeah, it's here. Now, can you see? This is the pancreas.
Right, sir.
Right? Now, what you are confused with, the transverse section and the longitudinal section. Now, this is the probe. Imagine that this is the probe. This probe has been put on the body like this. Is this transverse or longitudinal?
So it is transverse.
Very good. It is transverse. This is longitudinal or transverse?
Longitudinal, sir.
Longitudinal. But when I am putting this way probe onto the body and I am hitting the pancreas, will I see pancreas in longitudinal or in transverse section?
We will see in the transverse section.
No. Listen to the point very carefully. When I am putting probe with respect to body like this, it is transverse with respect to body, but the same thing will not be a transverse when I am talking with respect to pancreas, because when I am putting probe like this, I will not see the transverse section of the pancreas. I will see the pancreas in length.
Right.
Did you got my point? This is not confusion with you only. The freshers, do have these types of confusions. Now, what the point is, when I am putting, I am again repeating because this is very important. When I am putting probe like this, with respect to body, it is transverse. But when I am talking of pancreas, that will be actually a long axis, a longitudinal section of pancreas. Now, is this a transverse or a longitudinal section? If I will forget about the pancreas,
Then, sir, it is a transverse section.
but when I am seeing the pancreas, this transverse is now the longitudinal section of pancreas. Now, coming to your question. Imagine that this is the ovary. This is the ovary. Is
Sure.
ovary standing vertically in the body? Yes or no?
No. It is
No. Now, wait. Now, is this lying like this all in all patients? Yes or no?
not all patients, but it can.
Wait. Now, tell me how the ovary is with respect to body. Can you tell me?
It is lying like.
Lying like what? Okay, imagine that this is ovary. It is lying like this, lying like it is at obliquely at 20 degrees. Yes or no?
Yes.
20 degree in each and every patient.
Sure.
Yes or no? Yes or no?
Not every patient, sir.
Not in every patient.
Not
Now, listen to me. Ovary, as already discussed in the last question, that I don't know what is the location, not the location, position. What is the position of the ovary in this patient? I will say that the right ovary can be like this and the left ovary in this patient can lie other way. Now, coming to your question, should I put the probe transversely or longitudinally? What will decide? Dr. Sibley, what will decide how to put the probe on this particular ovary?
It will. Sorry, sir, I don't know.
You don't know, but the ovary knows. The ovary will decide whether you have to put probe like this, like this, like this, like this, or like that. Because whenever you see ovary in length on screen, on monitor, forget about the transverse and the longitudinal section, because this transverse and longitudinal section is with respect to body.
Right.
Then you have to forget this transverse and longitudinal section. Don't see to your patient. Don't see to the monitor, this hand, wherever you are scanning. Don't see to this hand. Forget about whether you are this way or that way. You have to see to the monitor whenever. Now, listen to me. Whenever the ovary is getting completely in length, then my hand can be, see to my hand also. Hand can be this way, this way, that way. Now, that can be transverse, that can be longitudinal, that can be in a slanting way like this, that can be any way. Now, the important point is, Dr. Sibley, forget this forever, that this is always transverse and this is always longitudinal when I'm talking of not body now, but of organ. The organ will decide whether the length of that organ is coming this way, that way, or that way. So the point is that you don't have to stick this is transverse and this is longitudinal always. No, this is with respect to body, not with respect to the organ. Okay.
Thank you.
Whatever was answer.
Thank you, sir.
Okay, welcome. Please mute your microphone. Next, whosoever is right now live, unmuted, please say hello. Who was the candidate? Okay, raise your hands. Next candidate, please raise your hand. Hurry up, hurry up. Dr. Padma, we are sending you unmute invitation. Accept it, and on accepting, say hello.
Hello, sir.
Hello. Yeah.
Sir, my question is, while doing transabdominal ultrasonography, how to get a good image when patient has a scar on the abdomen? Even after using frequency and depth knob, and
repeat your question. I am not getting your question properly. Please repeat your question.
How to get a good image on transabdominal ultrasonography?
Good image of what?
Uterus, gynecological ultrasound. Gynecological
Okay.
ultrasonography. When I'm doing transabdominal gynecological ultrasonography, how to get the good image when patient has a scar on the abdomen? Because even
okay, now what I am getting that if there is a scar on the
Yes.
abdomen and you are putting your probe
yes,
on the scar and you are
Yes.
scanning via the scar, how
Yes.
to get a good image in that case? Is that your question?
yes, sir, yes.
Yeah. Have you completed your gynae ultrasound with us? Yes or no?
Not yet, not yet.
Now see, this is the point. You have not gone to China and you want to see a street of China. Are you getting my point?
Yes.
So complete your course first, then maybe that this is already taken over there. We are not taking a class over here. We are taking your question and answer session. This is the question and answer session. I cannot show you a street of a China without going to the China. You getting my point? So
Yes,
please
sir.
complete your course first, and whatever is completed, most welcome, post your question, give me questions, whatever you have completed.
Then,
So
sir,
I will not take this question because this is already taken over there. This is in your
Okay.
course. This will be a new course over there and we will land nowhere. So I want to take question and answer session from those candidates who have completed their specific course, say gynae, color Doppler, abdominal, anything.
Yes,
So
sir.
next candidate,
Sir,
please raise your hand.
one more question is
Yeah,
there.
tell
sir.
me. Yeah.
Then how to use speckle reduction imaging and dynamic range and tissue harmonics to
Okay.
get.
Have you completed your physics?
Yes, sir.
Yeah. Now I will take that question. Yeah. Tell me how many years of experience you are having?
5 years, sir.
5 years. First, what you have to do, you have to set the frequency.
Yes, sir.
Frequency will depend on the patient.
Yes.
If patient is obese, you have to decrease your frequency.
Yes.
And if the patient is very thin, then you can increase your frequency. That is already discussed in great detail in physics and machine settings. Yes or no?
Yes, sir.
Then the next point is that you have to set your focal point. You have to set your focal point. The focal point should be near your target. That is already covered in your course. Yes or no?
Yes, sir.
Now the dynamic range. What is
Yes.
the point for now? The dynamic range. You are telling me how much the dynamic range should be. The dynamic range will increase the sharpness of the image. There
Yes.
are multiple things which you can confuse in between: brightness, contrast, and sharpness. Now
Yes.
the contrast is not the sharpness. The brightness is not the contrast. You have to first think what I am talking of. It is the sharpness, not the brightness. So whenever you want to see more sharp, anything more sharp, then you can adjust the dynamic range. This dynamic range is actually the pulse repetitive frequency. So the dynamic range is to increase or decrease the sharpness of any area. For example, you want to see very accurately where from the stone is starting and where from I have to take the measurement. To see the sharpness, to see the contours, you have to increase the sharpness. So this Dynamic range is for the sharpness, not for brightness.
Okay.
More bright you want to see, you can increase or decrease the gain.
Gain.
So gain will increase the brightness. That is the echoes itself. But
Yes.
this dynamic range is for the sharpness of the image. Anything else?
No, sir. Thank you.
Okay. Next
And
candidate, Dr. Yeah, welcome. Dr. Azhar, we are sending you unmute invitation. On accepting, say hello.
Hello, sir.
Hello. Yes, you are audible.
Uh,
Your question, please.
Sir, my question is that many times while scanning a fetus, we see a dolichocephalic shape of the head. That is, the AP diameter is more and the BPD is less. So the gestational age by head circumference is coming 2 to 3 weeks more than the biparietal diameter.
Okay, hold on. Let me take the whiteboard. We will draw this thing on whiteboard because that
Yes.
will not be very easy to make you understand on this platform where I am right now. I am
Yes.
now on camera. I will switch onto the whiteboard. We will draw this over there. I will note your question. So you
Okay.
please complete your question. Complete. I got your question, but I want
Okay,
you to complete the question.
okay, sir. Sir, so the gestational age is coming more than head circumference by the biparietal diameter. And so it will also affect the average gestational age. So at that time, what should we do? Because it affects the gestational age. That is average gestational age.
I've noted this. I've noted. Okay, I will take this on whiteboard. And meanwhile, Dr. Krishna, we are sending you unmute invitation. You please mute your microphone. Dr. Krishna, say
Yes,
hello.
sir. Hello, sir.
Yeah, you are audible.
Sir, what is the difference between frequency and frame rate, sir?
Have you completed your physics?
Yes, sir.
Honestly, completed means
Yes, sir. I
100%.
have gone
Yes
to
or no?
10 sessions. Yes, sir. 10 classes I have completed, but I didn't understood the difference between frequency and frame rate. Both are same, I am thinking, sir.
No. Frequency and frame rate. I will take this on whiteboard. Frequency and frame rate, they are different. Frequency is different and the frame rate is different. I will take it on whiteboard. I have noted this question also. Now the name is coming here, iPhone. I don't know what is the name of the candidate. We requested you time and again to join with your name. So whosoever is getting the invitation right now, and that person is using the iPhone, accept it, and on accepting, say hello. Quickly. And others, please keep on raising your hands. I will take only raise hands. I will not take the questions from comment box because I am getting sufficient questions from the hands, raise hands. Yeah, say hello.
Hello.
Yes, what is your name?
Yes, hi, I'm Dr. Nupur.
Dr. Nupur, tell me.
Yes. Yeah, my question is how to calculate scar thickness in a full-term pregnancy.
Confusion, scar thickness. You are a gynecologist?
Yes.
Very good. I will love to discuss this scar thickness with you because almost half of India is having confusion with this scar thickness. So I will take 3 questions on board: scar thickness, frequency versus frame rate, and the BPD and the head circumference. I mean the dolichocephalic head and etc. So 3 questions for whiteboard. I will switch to the whiteboard. What is your name? Last candidate, gynecologist. What is your name?
Dr. Nupur.
Dr. Nupur. Okay. Any more candidate is having any question? Please raise your hands. Please raise your hand. No. So now we will switch to the whiteboard. So starting from Dr. Nupur, you are online? Dr.
Yes,
Nupur, say hello.
yes. Hello.
So
Yeah.
are you able to see the whiteboard?
Yes, sure.
Yeah. Dr. Nupur, being a gynecologist, tell me something from your experience.
Okay.
Not scanned by you, scanned by somebody or by you also. Have you seen an ultrasound report with a normal scar? By normal scar, I mean a healthy scar. And when you operated, it was about to rupture?
Yes, it has happened many times.
Many times.
Yeah.
Why? Because I told you that half of the India is confused with this scar thickness.
Okay.
What I have to see in a scar? Have I to measure the scar thickness or the myometrium beneath the scar? Now, this is not ultrasound. This is gynecology. What you tell me? What I have to see, what I should worry with no myometrium beneath the scar, or if there is a myometrium beneath the scar, which one is a healthy scar? With myometrium or without myometrium?
With myometrium.
Very good. Now, urinary bladder, UB. The uterus is coming this way. Right? So this is the os somewhere here. Okay. Now, when anybody is not anybody, many persons are measuring, they are measuring the scar here. Yes, it is. It has to measure over here, but the bladder wall. See to the bladder wall. Bladder. I am drawing this in a green color. Now, what they will do? They will measure this. Will this include by default UB wall also?
Yeah, it can.
How? Not it can. It is there. If that person is taking everything in account, everything means from this point to this point, it automatically is including the urinary bladder wall also. Now tell me, how much is the urinary bladder wall thickness?
Don't know exactly.
3 millimeters. Everybody knows this. 3 millimeters. Now, if that person is taking the measurement of the scar, and that scar, if 4 millimeters, with this urinary bladder wall, how much the scar is actually?
1 mm.
1 millimeter only. Now, this 4 is not 4, but 1 millimeter if that person is taking the urinary bladder also in account. Now, to avoid this.
But my question is, when the patient is...
I will come to your question.
Yeah, full term then.
I will come to your question.
Okay.
Now, if I will take this not on TAS, but on TVS, bladder is not over there. And the things will be much clear that I am not including the wall. It is already collapsed. What is collapsed? Urinary bladder. Now coming to the first point. So the first important point is, don't include the urinary bladder. And the most important is that don't take this on PAS. That is point number one. Point number second. So this has to be taken on TVS, transvaginal sonography. Now, let me erase this. Now, when you are measuring the scar, for example, this is the scar. This is the scar. When you are measuring, are you concerned of the connective tissue, I mean the scar, or you have to see if there is any myometrium? What you have to see, if there is any myometrium beneath the scar, and if there is a thin myometrium, then only it is a healthy scar. I'm repeating my last statement. This is very important. I have to see if there is a myometrium beneath the scar. I am not concerned of this scar. I have to see whether there is any myometrium beneath the scar. Then only I can label it with a healthy scar. Now term pregnancy, coming to 38 weeks. 38 weeks.
Yes.
You have to put a fundal pressure. On putting a fundal pressure, if there is bulging, then irrespective of having a 4, 5, 6 millimeter scar, so-called in inverted commas, that is not a healthy scar. So put your fundal pressure and see for the bulging, and see for the myometrium beneath the scar, and don't include the urinary bladder, and never take it on transabdominal ultrasound. And now, if your patient is not giving consent to insert the probe, you can put a fundal pressure when you are taking transabdominal, and you have to keep that you are automatically including the 3 millimeters, then just exclude roughly 3 millimeters. And if the bladder is overdistended, why not to measure the bladder wall, and you have to exclude that much from the total of the scar, whatever the patient is showing you on ultrasound screen. Anything else?
No, thank you so much.
Okay, welcome. Please mute your microphone. I have to take the next question.
Yeah, sure.
So the next question from sorry, I forgot the name, frequency and the frame rate. Now the frame rate, FR, frame rate. Frame rate means how many frames are there in 1 second. I'm repeating, how many frames are there in 1 second, and if there will be more frames in a particular period, the clarity of the image will increase. So the image, the video, now see, when you are seeing any video of a Bollywood or a Hollywood Shah Rukh Khan, he is dancing properly. Why he is dancing properly? Because there are many frames in that second. For example, there are 10,000 frames per second. Then the image, not the image, then the video will be smooth. But recall a cartoon show where the cartoon, if dancing, is having jerky movements like this. That cartoon show is having less of frames per second. That is why you are seeing the jerky movements over there. And the next example is the action replay of a football or a cricket match. Whenever you are seeing an action replay, it is slowed down there. What is slowing down there? The number of frames per second. So frame rate is the number of frames per second. Now, this will decide the resolution of the machine, not resolution of the machine, the clarity of the image. More the frames there, then you will get a clear image. Now, this thing is already discussed. How to increase the frame rate of your machine? We are having about 3 classes in physics and machine setting there. So this was the frame rate. Now frequency. Frequency is different. Frequency, now this is the wavelength. What is wavelength? The wavelength is the distance from one compression to another compression, or one rarefaction, first rarefaction to second rarefaction. So similar points from two waves, that is wavelength, and that is lambda. So this is the wavelength. Now, shorter the wavelength, now see, shorter the wavelength, more the frequency. So shorter the wavelength, more the frequency. So this is frequency. So frequency and frame rates are not same. Frequency is when I am having a short wavelength, and the frame rate is deciding the resolution of the image or the video, the scenario, what is going on over there, and the real-time scanning, that is depending on the frame rate. Now, how to improve the frame rate? There are multiple things which you have to do, the depth, etc., which is already discussed in your course. Now, the third question was regarding the head. Now, the point in this head, now see to my head and see to your head, or somebody who is sitting next to you. In me, it is more oval. In other person, it will be more round. Who is normal, he or me? Both are normal. And so is the fetus also. Some fetuses will have more of oval. And if it is more of oval, now see, this red is more of oval. And if it is more of round, now see, if it is more of round, then the BPD will be more. Yes or no? Yes. This is simple logic. If it is more round, then BPD will be more. And if it is more oval, the BPD will be less. But the head circumference in both will be almost same. This is the important point. The head circumference in this more round or more oval will be approximate. So coming to the point now, if your BPD is not corresponding, maybe that you are getting more of BPD or a less of BPD expected, I mean, go for head circumference and keep your BPD in your dustbin. Throw it in the dustbin, because head perimetry, head circumference is telling you that you are dealing with a 34 weeks fetus. And if BPD is telling that you are not dealing with the 34 weeks, you are dealing with the 30 weeks only, take head circumference in account and throw at that point of time BPD in your dustbin, because maybe that you are dealing with more of an oval head. So these were the questions which I wanted to take on the whiteboard. So we will take a short 5 minutes break. We will get back to you soon.